اسم حسام عباس داود، دكتور حسام عباس داود، اختصاص تمريض بالغين. محاضرتنا لهذا اليوم هي من مادة الأدلت nursing for second stage for College of Nursing. Now I will present this lectures, Gynecologies and myocardial infarctions. First of all, myocardial infarction or the angina pectoris, said ischemic heart disease. Started with the angina pectoris definition is the chest pain caused by inadequate myocardial oxygen supply resulting from narrowing of the coronary arteries. Okay? Causes atherosclerosis, vasospasm, aortic stenosis, and hypertension, and genetic and smoking factor. Finally, alcohol. If you make summaries for that any lack in the blood supply for the coronary artery, which supplies myocardial infarction with other blood, that meaning had resulted from the chest pain. Signs and symptoms for the angina pectoris started with the substernal and crushing pain. Substernal and crushing pain. Type of the pain or the characteristic of the pain started with the right to the arm, started for the both arm, pain duration 3 to 5 minutes, and also usually occurs after exertion, emotional assessment, or the exposure to the cold, but also can develop when the patient at the rest. This first and very important signs. If you say type of the pain, started with the stamp pain or the crushing pain, also that have the need for the effort or the during exertion pain. Also, you can say dyspnea and palpitations and tachycardia and sweating, also epigastric distress. You can say comfortable. Also, you can say anxiety because type of the pains and the stress from the diseases. How can you diagnose these cases during the nursing? Starting with electrocardiography (ECG), some changes happened in the ECG. Started with the ST depression and T-wave inversion during acute pain. Second, stress test, very important. That means a treadmill test. Also, coronary arteriography. Another word here, cardiac catheterization. Also, you can use Holter monitors to diagnose it. Also, you can use cardiac enzymes. And finally, you can use a blood chemistry and increase cholesterol. This means some cases that are the need for this. Okay. Now, as the nursing during nursing process for these diseases, you can start it with some nursing intervention. Very important. Started with the assess for the pulse rate, blood heart pressure, and the respiration rate. Also, you can assess for the chest pain. Also, give O2 by the mask. Assess for the cardiovascular status because cardiac are responsible for the pumping of blood for the all vessels in the body. Also, give medication as per the order. The common medication in these cases you can use NSAID sublingually. Okay. Also, you can keep the patient in the semi-fetal position, semi-sitting position. That will help patient to blood supply. Also, you can monitor and record vital signs for the patient because exactly during angina pectoris. Also, you can mention some types of the angina pectoris, but that lead for the complicated lectures. Okay. Now you can obtain ECG reading during acute attack. Very important to make a clear diagnosis for these cases. Also, you can maintain patient diet, low sodium, low calories, and low cholesterol. Very important. Also advise patient to rest if the pain begin. Why? Because the cause for the pain started with the effort pain. Also, you can monitor laboratory tests for the patients. Also encourage patient to express fears, because patient, if you put the patient in the cardiac care heading, that means patient fear from the unknown, fear from death, fear from many factors. Educate patient to stop smoking and change blood pressure daily. Very important. Teach patient about dose, time, side effect of the drug during stress. Also avoid stress. Why? Because you know that this other medication very important, because this medication affected in the heart and the cardiovascular heart muscles. Okay, that means be careful during uses this other medications. You can make a treatment for these cases. You can use angina. You can use angina bacteria. And sometimes use BTCA. That means balloon. If in some cases complication from the complication from angina bacteria started with myocardial infarction, congestive heart failure, arrhythmia, cardiogenic shock, and cardiac arrest, the final stage. Okay. Another subject very important: myocardial infarction. MI. That mean what mean? That mean other name, coronary occlusion heart attack. Coronary occlusion heart attack. Myocardial infarction refers to the process which the myocardial tissues is destroyed. It's the regions of the heart and derived from the inadequate blood supply because of the reducing coronary blood flow, allowing for the myocardial oxygenation, lead for the necrosis portion of the myocardial muscles. I can say that لفترة كبيرة you can't compare between angina pectoris and myocardial infarction. In the angina pectoris, just narrowing resulting from the blood supply. Here in the myocardial infarction, no. That means low blood supply and low have oxygen lead for the destroy myocardial muscles. That means تلف الخلايا يعني تلف أجزاء من عندها عضلة القلب. Etiologies: you can causes of the reducing blood flow. That means narrowing of the coronary artery or the atherosclerosis, completed occlusion of the artery owing impulses, thrombosis. That means also myocardial necrosis can cause occlusion of the coronary artery, oblique and rectal region of the impulse during thrombosis. A clinical manifestation: you can say that started with the pain. Very important signs. Pain is the cardinal symptoms of the myocardial infarction. Also anxiety and fear of the impending death, nausea and vomiting. Very important. By have attention about nausea and vomiting. Also breathlessness. Okay. Also collapse or syncope. That means loss of the consciousness in some cases. Physical signs, that means signs of the sympathetic activation, pallor, sweating, tachycardia, signs of the vagal activation or the nausea, vomiting, يسميها bradycardia, signs of the impaired myocardial infections اللي هو hypotension, oliguria and cold sulfurs. and signs of the complication هو mitral regurgitation and pericarditis. Diagnostic test or the diagnostic evaluation, you can diagnose the case from the electrocardiogram, ECG, blood test, cardiac enzymes, echocardiogram, chest radiographies, and coronary angiography, and exercise stress test. Medical management for these cases or the nursing management, you can start with the immediate management for the first 12 hours. Analgesic, morphine, sulfate, and نسميها anti-emetic. Also اللي نسميها anti erythropoietic مضادات التخثر وانتي ابليتليت ثيرابي والانتي coagulation. You can use anti-anginal therapy, also surgical therapy in some cases. Nursing process for the myocardial infarction. Assessment for the careful history, description symptoms, chest pain, palpitation, dyspnea, and syncope, and each, if you say each symptoms must be evaluated regarding the time, duration, participation, relative factors, very important. Level of the conscious for the every patient, very important during coronary care unit. Okay, nursing diagnosis. If you meet patient with this other cases, you need to the nursing diagnosis. You will find the first one with the chest pain related to the reduced coronary blood flow, high risk for the breathing pattern and the effective and related to the fluid overloaded, and anxiety related to the fear from the death, high risk for the tissue يسميها tissue هذا perfusion اللي هو تخليني low cardiac outputs. وبعدين finally health maintenance alteration to the related to the adherence therapeutic regimen. Very important. You should follow a system or a process for the treatment. Nursing intervention for these cases. You will start it with the relief or control of the chest pain, elevated respiratory difficulties, reduce anxiety level, maintaining adequate tissue perfusion, help patient to adhere to the self-care program. Very important for every student. You should know definitions, signs and symptoms, communication for any cases. Okay. After that, a student able to make a clear nursing diagnosis to the treatment from these cases. These two diseases very important now because cardiovascular diseases, okay, the second factors from the mortality rate in the worldwide. Okay, that means you should be more focusing about these cases. Thank you for listening.